governor has laid out a thoughtful plan. Every entity has a different responsibility. You recall initially it was all about getting doses to the nursing homes, and I'm very proud that the state of New York has vaccinated 100% of nursing home staff and patients who are willing to be they've been vaccinated, who are willing to be vaccinated. So that is progress. This is after just literally a month after we received our first doses coming to the state of New York. That was our most vulnerable population. Getting them done first and efficiently, and now many of them are getting their second doses, was an important milestone for us to hit. Then we had to get them into the healthcare workers, places where people are the most vulnerable because they're exposed to COVID patients every single day in a hospital or medical setting. We've been working very intensely on that. In New York State has about a 72% average of getting those vaccines out. That's about our average here in Western New York. And some have been set aside for people who weren't sure the first go round but being offered again. So that'll be 100% very shortly as well. So that was the nursing homes, the healthcare facilities. We also wanted to make sure that the county public health departments could handle what we consider the public essential workers, firefighters, police, teachers, other people on the front line. So that is their jurisdiction. Pharmacies, now that we've been told just literally a week ago that the population that we thought we could handle at about 2.1 million individuals eligible, which are those healthcare workers and over 75, you know that the CDC just expanded that to 65 and older a week ago today. So all of a sudden, in order to accommodate now 7 million people eligible, a dramatic change in our calculations, we have enlisted the pharmacies to handle 65 and older. And facilities like this, the mass distribution states staffed and set up by the state of New York, will be handling basically the general population of people who fall through the cracks of those other areas. So that's why this is an important piece of a larger puzzle of different places that we've identified that we think are best suited to be able to handle those populations. And to be able to go to a site here today, as I did last week in Syracuse, opening sites, it's actually a very emotional experience when you think about what we've been through.